Imagine just walking into a hospital.
Right. The place you trust implicitly.
Exactly. You go there when you are, at your absolute most vulnerable.
Yeah, completely unaware of what's happening behind the scenes.
Right. And you are entirely unaware that the system around you is, well, it's actively collapsing.
And it's collapsing because it fundamentally refuses to listen to its own doctors.
Yeah, it isn't just lacking funding, right? It is actively silencing the voices trying to save it. So, welcome to our deep dive.
We've got a fascinating one today.
We really do. Today, we are looking at the 14-year journey of a physician named Dr. Kadiyali Srivatsa.
The stack of sources we have for this is just immense.
It's massive. We are looking at confidential clinical files, whistleblower documents, employment tribunal records, and even ancient Vedic philosophy.
Which sounds like a strange mix, but it makes perfect sense once we dig in.
Definitely. We are going to explore what happens when an institution decides that its reputation is, more important than your life.
The documents we are examining today, they really map out the anatomy of an institutional failure.
Yeah, they map it out day by day, email by email.
Exactly. But we are looking at this failure through a very specific, a really profound philosophical framework.
Right, which is what makes this deep dive so different.
We are looking at the law of the universe, and specifically the ancient Indian concept of karma.
I want to stop right there and just define that lens.
Yeah, that's a good idea.
Because I know when I used to hear the word karma, I instantly thought of, cosmic revenge.
Oh, absolutely. Most people do.
Right. It's the idea that if you cut someone off in traffic, the universe is going to give you a flat tire an hour later.
Like it's some sort of magical accounting system?
Yeah, it's treated like superstition.
Which is, it's actually a complete misunderstanding of the concept.
Totally.
In the ancient Indian traditions, from the Upanishads to Jain texts, karma is essentially the purest physics of the soul.
The physics of the soul. I love that phrasing.
It literally translates to action. It is the universal mechanical principle of cause and effect.
So it's not a judge sitting on a cloud.
Not at all. Think about it less like a cosmic judge weighing your sins and more like, like gravity.
Right, just a fundamental law.
Exactly. If you drop an apple, it falls. If you perform an action or hold an intention, you generate a consequence.
Even if you just choose to remain silent.
Yes, even silence. When you choose to remain silent when you should speak, you generate a consequence that must eventually manifest.
In software engineering, we have this concept called technical debt.
Oh, that's a great comparison.
Yeah, it's like if you write sloppy code just to push a product out faster, the app might run fine for a while.
Right, you hit your deadline.
Exactly. But that bad code is still in the foundation.
Just waiting to cause a problem.
Yeah. Eventually, you add one too many features, the technical debt comes due, and the entire system crashes.
It's inevitable.
And it's not the computer taking revenge on the programmer, right?
Right.
It's just the consequence of building on a corrupted foundation.
That is a brilliant way to conceptualize it.
Thanks. It feels very similar to what we're looking at here.
It is. What we are exploring today is how massive institutions, organizations tasked with public health, accumulate ethical technical debt.
Ethical technical debt, that's heavy.
We are looking at how systems generate karmic debt by suppressing the truth.
By victimizing ethical people.
Exactly, and ignoring safety warnings. And we will trace how the current global healthcare crisis is a result of that.
Like the terrifying rise of untreatable superbugs, right?
Yes, the antimicrobial resistance crisis is the direct delayed consequence of that broken moral law.
So to really grasp the mechanics of this collision between a truth teller and a bureaucracy, we have to look at the man at the center of these files.
Dr. Kadiyali Srivatsa.
Right. He's a physician with 40 years of experience in pediatric and intensive care.
A lifetime of medical dedication.
But the records point out something fascinating. You can't just look at his medical degree to understand why he blew the whistle.
No, the degree only tells half the story.
You actually have to look at his lineage.
His ancestral background is deeply significant here.
Tell me about that, because this blew my mind in the prep notes.
Well, Dr. Srivatsa belongs to the Kadiyali Upadhyaya family, specifically the Vishwamitra Gotra.
And a Gotra is like a clan, right?
In the Vedic tradition, a Gotra denotes a lineage tracing back to a common ancient sage.
And the story of Vishwamitra is intense. He wasn't always a sage, was he?
No, not at all. He was born a king named Kaushika.
So he had all the power.
Immense military power, wealth, political influence. But the texts describe a profound realization he had after an encounter with another sage, Vashista.
What happened?
Kaushika realized that political power, bureaucracy, and physical force are inherently limited. They are fragile.
So what did he do?
He literally renounced his entire kingdom. He walked away from all of it to seek spiritual realization through tapas.
Tapas, meaning like deep asceticism.
Yes, deep disciplined asceticism and the pursuit of ultimate truth.
That is quite the career change.
Right. And through this, he transformed from a king relying on power into a brahmarshi, a sage relying on cosmic truth.
But how does ancient history about a king renouncing his throne apply to a modern doctor working in a British clinic?
Because it establishes a generational responsibility.
Oh, I see.
In this tradition, there is a concept called lokasamgraha.
Let's break that down for the listener.
So, loka means the world, and samgraha means to hold together or protect.
To protect the world.
It is the sacred duty to act for the welfare and maintenance of humanity.
Wow.
For a Brahmin lineage like Dr. Srivatsa's families, who were historically scholars and priests connected to deities like Kartikeya, the deity of healing, it's a big deal.
It's not just a nice idea, then.
No, lokasamgraha is not a metaphor. It is a mandate.
A mandate you're born into.
You are born with the responsibility to protect society through knowledge and truth.
So when Dr. Srivatsa puts on a white coat, he isn't just, clocking into a job.
Exactly. He is fulfilling an ancient dharmic duty to protect life.
Okay, so you have this physician steeped in a generational oath to protect patients, colliding with the UK National Health Service.
And this happened right around 2004.
Right. The NHS was undergoing a massive policy shift at the time.
They were trying to save money.
Yeah, local health authorities like the Surrey Primary Care Trust, the PCT, they were rolling out these pilot nurse-led practices.
Walk-in clinics designed for sheer volume.
The administrative goal was pure throughput, right?
Yeah, they wanted to increase the number of patients seen per hour while lowering operational costs.
And I get the administrative appeal. I really do.
Sure, on paper it looks great.
On a spreadsheet, having nurses handle the front line frees up doctors and saves a fortune.
But the specific mechanics of what Dr. Srivatsa was asked to do are staggering.
Staggering is the right word.
The administration asked him to train nurses to formally diagnose illnesses.
And to prescribe medications, including antibiotics.
Yes, and they gave him exactly 15 days to complete this training.
Wait, 15 days. That's it.
Exactly 15 days.
Which is wild when you consider medical schools, 5 years?
Let's look at the medical mechanics of what that actually means.
Please, because it sounds impossible.
To become a doctor competent at making a differential diagnosis, you undergo 5 years of rigorous medical school.
Plus years of supervised clinical practice.
Yes. You are learning anatomy, physiology, pathology, complex pharmacology.
Right, because diagnosing isn't just matching a symptom to a drug.
Precisely. It is about clinical intuition.
Which you can't just memorize from a chart.
It is the ability to look at a patient, synthesize their history, observe subtle visual cues like capillary refill time or skin pallor.
To see if they're actually in danger.
Right, to distinguish a minor viral infection from early-stage, life-threatening bacterial sepsis.
And you cannot download that level of clinical intuition into a flowchart.
And you certainly cannot teach it in a 2-week crash course.
I have to push back a little just to play devil's advocate for a second.
Go for it.
Are we saying nurses shouldn't be treating patients? They are the backbone of the hospital system.
Oh, not at all. Nurses are vital, highly skilled professionals.
Okay, good.
But nursing and medical diagnoses are two distinct disciplines requiring different educational foundations.
That makes sense.
The issue here is the institution bypassing that necessary medical foundation purely to save money.
They were effectively giving unqualified personnel fill-in-the-blank algorithms.
And telling them to practice medicine.
And because Dr. Srivatsa was on the front lines, he started seeing the catastrophic results of this spreadsheet-driven medicine.
The clinical case files in this stack of evidence are genuinely terrifying.
Let's talk about the case of Zafar and Sana from 2007.
That case perfectly illustrates the danger.
What happened there?
We are looking at a pediatric patient who was under the care of the prestigious Great Ormond Street Hospital.
Okay, so a very serious pediatric facility.
Yes. The specialist there sent clear instructions to the local clinic. The child needed to be transitioned to hydrocortisone.
Which is a critical baseline drug, right?
It's vital for managing specific endocrine issues.
But the local clinic, run by staff without that deep pharmacological training, They completely misinterpreted the instructions,
They simply issued a repeat prescription for prednisolone.
which is an entirely different steroid.
Exactly. They contradicted a specialist and administered the wrong drug to a vulnerable child.
That is terrifying. And this wasn't an isolated incident either.
Sadly, no. There was the case of Mr. Asger.
Right, the elderly man.
He was an elderly man displaying serious, complex symptoms.
But the untrained staff, they probably just relied on a rigid triage algorithm.
An algorithm that didn't account for his specific nuances.
Then they sent him home.
Yes. It was a complete failure of triage that endangered his life.
So Dr. Srivatsa saw the very system designed to heal, actively inflicting harm.
And that's when his conscience kicks in.
Right, because the Hippocratic Oath literally says, first, do no harm.
He couldn't just stand by.
But what are the actual mechanics of blowing the whistle when the harm is coming from the boardroom, not the operating room?
Well, in 2006, he initiated a formal, legally protected whistleblower disclosure to the Surrey Primary Care Trust.
Under the Public Interest Disclosure Act, right?
Yes. In the UK, this is supposed to be governed by that act, which is explicitly designed to protect employees who report unsafe practices.
So he compiled the data, he documented the clinical errors, and he sent it to the highest levels of the local health authority.
He did everything by the book.
And, reading his personal writings, you realize he genuinely believed they would thank him.
He really did.
He thought, I have undeniable proof that our protocols are harming people. The administration will see this, realize the mistake, and fix the system.
That assumption is the tragedy of an ethical mind navigating an unethical bureaucracy.
Wow, that's a powerful way to put it.
He believed he was operating within a rational system that valued human life above all else.
Because that's what a hospital is supposed to be.
But institutions often operate on a completely different set of values.
Values like what?
Values centered on self-preservation, reputation management, and the suppression of any truth that threatens their structural integrity.
Which brings us to the friction between truth and bureaucracy.
The fallout was incredible.
Yeah, what actually happened when he submitted that highly confidential file?
The chairman of the PCT did not initiate an independent safety review.
Of course not.
Instead, he took Dr. Srivatsa's confidential whistleblower complaint and forwarded it directly to the very clinic managers that Dr. Srivatsa was reporting for clinical negligence.
Wait, how is that even possible?
It's an unthinkable breach of protocol.
That is like a police officer taking a witness's sworn statement and handing it directly to the mob boss they are testifying against.
That's a complete violation of basic safety.
And the retaliation must have been insane.
It was immediate and mechanical. Suddenly, a fabricated avalanche of complaints was filed against Dr. Srivatsa. The tribunal records show 12 separate complaints filed against him in a single year between 2007 and 2008.
How does a bureaucracy just invent 12 complaints?
They utilized their administrative power.
They just start digging.
Yeah, they pull old files, look for minor clerical anomalies, reframe routine patient interactions as instances of poor communication.
They weaponize the human resources department.
It is a classic institutional suppression tactic.
I mean, if you manufacture an avalanche of defensive paperwork and disciplinary hearings,
You force the whistleblower to spend all their time, emotional energy, and financial resources defending their own medical license.
you completely paralyze them.
Exactly. You shift the focus away from the lethal clinical errors of the institution and onto the character of the person who exposed them.
The toll this took on Dr. Srivatsa and his family is just heartbreaking.
It really is.
The sources include excerpts from his autobiography, Tears of Happiness, and you can really feel the devastation.
He was pushed to his absolute limits.
He faced total bankruptcy. The sheer relentless stress destroyed the peace of his home.
Even his children suffered.
Yeah, his kids were ostracized at school because of all the rumors surrounding his prolonged investigation.
He was eventually forced to move his family to Germany and then back to India.
Completely stripped of the career he had dedicated his life to.
He was brought to the absolute brink of human endurance.
And in his writings, he describes sitting in India, financially ruined, questioning his own sanity.
And in a moment of profound despair, he blamed his own mother.
He blamed her for raising him, to be honest.
Yes. He felt that her rigid teachings of integrity were the sole cause of his family's suffering.
I mean, you can understand why he felt that way.
In his eyes at that moment, if he had just ignored his conscience, kept his head down, and blindly processed the patients through the flawed algorithms,
He would still have his home, his pension, his peace.
Exactly.
When a person is punished that severely for doing the exact right thing, it just breaks their worldview.
But his mother's response to his anger is easily the emotional center of this entire story.
Tell me about her response, because it's just amazing.
It is a moment of pure, grounding wisdom. When he told her that her teachings had ruined him, she did not apologize.
She stood her ground.
She told him, "Do not become angry. Do not seek revenge. Sit back and wait."
Sit back and wait.
She said, "Those who hurt you will eventually destroy themselves through their own actions, and if you are fortunate, God will let you witness the truth being revealed."
Sit back and wait. That is so incredibly counterintuitive.
Most people would say fight back.
Right. When you are under attack, when your livelihood is being destroyed by liars, the biological instinct is to strike back.
You want to clear your name in the press, sue them, get revenge.
But her advice is rooted entirely in the deeper mechanics of Dharma, isn't it?
Yes, completely. The Sanskrit root of Dharma is dri.
Which means?
It means to uphold, sustain, or bear. Dharma is not about seeking a reward or winning a battle.
It's much deeper than that.
It means doing what is right, upholding the moral order of the universe, even when the world violently punishes you for it.
Is this related to the concept of nishkama karma in the Bhagavad Gita? I remember reading about that.
Spot on. Nishkama karma translates to selfless action, or action performed without any attachment to the fruits or results of that action.
Action without expecting a reward.
In the Gita, Lord Krishna tells the warrior Arjuna that he has a right to perform his prescribed duty, but he is not entitled to the fruits of his actions.
And Dr. Srivatsa's mother was basically reminding him of this fundamental physics of the soul.
His duty was to speak the truth to protect patients. He fulfilled his dharma.
And the retaliation of the NHS was just out of his control.
By telling him not to seek revenge, she was saving him from generating his own negative karma.
Oh, because anger and revenge act as poisons to the soul?
Exactly. She was telling him to trust the universal law, that truth eventually protects itself.
So if Dr. Srivatsa was acting on Dharma, what exactly was the NHS operating on?
Well, that's where we look at institutional karma.
Yeah, because the General Medical Council, the British Medical Association, they all piled on. Let's look at how an organization designed for healing becomes an instrument of destruction.
It happens when the institution begins to prioritize its own image, its power, and its protocols over human life.
The evidence shows a pattern of systemic, deliberate, ethical breaches.
Yes, like how they dug up dirt on Dr. Srivatsa. The clinic staff illegally accessed confidential patient records without consent.
Which is a flagrant violation of the Caldecott principles in the UK, right?
Those are the absolute bedrock rules of patient privacy.
Yeah, you can't just browse patient records for fun.
But they shattered patient confidentiality just to find ammunition against a doctor who was trying to save those same patients.
And it wasn't just the local clinic either.
No, when Dr. Srivatsa turned to his union, the British Medical Association, to protect him, things got worse.
The BMA, the people who are supposed to have his back.
His representative actively evaded his meticulously documented 99 points of clinical and administrative wrongdoing.
They brushed a massive safety hazard under the rug just to maintain the institutional status quo. And then there's the TTE loophole.
Oh, the TTE situation.
When I read this part of the documents, my jaw literally dropped. Can you explain the mechanics of what the PCT did here?
So in 2011, Dr. Srivatsa was finally taking his case to an employment tribunal.
After years of fighting.
He was going to present his evidence of retaliation. But right before the tribunal, the Surrey PCT suddenly transferred the contract for the surgery to a private company.
The company called Practice Surgeries Ltd, right?
Yes.
Okay, so the change in management. But how does that affect his lawsuit?
Under the UK's Transfer of Undertakings, Protection of Employment Regulations, known as 2UE, when a business is transferred, the employees and their associated liabilities transfer to the new owner.
Okay.
The PCT used this regulation to forcibly transfer Dr. Srivatsa's employment, along with all the pending lawsuits and legal liabilities, to this new private entity.
Hey, hold on. You lost me.
It's confusing on purpose.
Are you telling me a government health authority can just transfer a human being's legal employment to a private shell company to escape a lawsuit?
That is exactly what they did.
They can just sell their liability.
It is a bureaucratic shell game. The Surrey PCT, the exact organization that retaliated against him, that covered up the clinical errors, that leaked his confidential complaint.
They just wash their hands of him.
Yes. They could stand in front of a judge and say, He's not our employee anymore. We aren't liable for what happened to him.
They hid the truth under a mountain of legal paperwork.
Which brings us back to the idea of technical debt, or karma.
Right, because a lawyer finding a loophole doesn't mean the action didn't happen.
Exactly.
But can a faceless bureaucracy actually accumulate karma? I mean, it's not a person.
Yes, because an institution is fundamentally a collective of human actions, intentions, and compromises.
Okay, that makes sense.
In Jain philosophy, karma is not an abstract concept. It is conceived of as actual, subtle, particulate matter that adheres to the soul.
Actual matter.
Yes. And the mechanism that causes this matter to stick is passion. Specifically greed, fear, anger, and arrogance.
So these negative drivers act as a glue.
They act as a karmic glue, which is called kaya.
So every time the administration chose to protect their throughput targets over a patient's safety, they were generating kaya.
When the NHS silenced doctors like Dr. Srivatsa or like Charma Chowdhury.
Oh, the radiology manager mentioned in the file.
Yes, she was destroyed for exposing financial fraud. When they did that, they generated immense karmic debt.
When they replaced the nuanced art of history-taking with rigid algorithms, they prioritized money over human life.
The moral conclusion here is that the damage of victimizing an ethical person does not simply disappear because a PR team managed the optics.
That damage accumulates in the foundation of the institution.
A system built on suppressed truth becomes inherently unstable.
And this perfectly bridges to a fascinating academic paper on theoretical physics that was included in the source material.
Regarding the false vacuum.
Yes, it is a stunning metaphor for the state of global healthcare.
Let's explore the physics of it first, just to ground it.
Okay, so in quantum field theory, a vacuum isn't just empty space, right? It's a space with the lowest possible energy.
Correct. A true vacuum is stable because it is at the absolute floor of energy.
But a false vacuum is a state that appears stable because it's sitting in a little local dip in energy.
It looks fine, but it's actually at a much higher fragile energy level than the true vacuum.
So it's metastable.
It can exist for a long time, but it is fundamentally precarious. If a large enough disturbance occurs, the false vacuum can decay.
It plunges down into a true vacuum,
releasing a catastrophic amount of energy that actually alters the fundamental laws of physics in that space.
Now, I'm looking at this physics paper, and I'm struggling to see how quantum field theory connects to a walk-in clinic in Surrey prescribing the wrong steroids.
Think about the energy states as states of institutional truth. Modern healthcare has been living in a false vacuum.
The reliance on algorithmic triage.
The massive, unthinking overprescription of antibiotics to keep the line moving, the silencing of whistleblowers, it all created an illusion of stability and efficiency.
The waiting rooms were full, the spreadsheets looked good.
So the NHS found a temporary, highly fragile state of efficiency.
And they defended that fragile state by attacking anyone who pointed out the cracks.
But underneath, the foundational ethics were rotting.
The system was resting on a fragile ledge.
Accumulating karmic debt by ignoring the fundamental biological reality of how diseases adapt and how healing actually requires human intuition.
And Dr. Srivatsa saw the decay happening.
He did.
The records show he warned them in the 1980s about antibiotic resistance. And he blew the whistle in 2004 about the diagnostic errors.
But they silenced the warning.
So what happens when the false vacuum collapses? What does the true vacuum look like?
We are living in it. The accumulated karmic debt is manifesting today as a global collapse in healthcare.
And the most terrifying biological evidence of this collapse is the antimicrobial resistance crisis.
The AMR crisis. The numbers in the documents regarding AMR are paralyzing.
Yeah, we are looking at a projected 169 million AMR-associated deaths by the year 2050.
To contextualize that, that is more than 5 times the official global death toll of the entire COVID-19 pandemic.
5 times COVID.
It's hard to even fathom.
And we aren't talking about a sudden novel virus here. We are talking about the steady, mechanical failure of the fundamental drugs we rely on to survive.
The sources note that antibiotics historically added 23 years to the human lifespan.
But under current AMR trajectories, life expectancy in low- and middle-income countries is projected to fall back to 58 years by 2050.
Let's look at the biological mechanics of how this happened, because it directly links back to the nurse-led clinics Dr. Srivatsa was warning about.
Okay, let's break it down.
Bacteria multiply roughly every 20 minutes. When a patient comes in with a viral sore throat, antibiotics will do absolutely nothing to cure them.
Because antibiotics only kill bacteria, not viruses.
Right. But the patient is demanding a pill, and the untrained staff member just wants to clear the waiting room.
So they prescribe the antibiotic anyway, just to get them out the door.
Exactly. When you introduce an antibiotic into a body that doesn't need it, it acts as an evolutionary pressure cooker.
It kills off all the weak, susceptible bacteria in the patient's microbiome.
But the strong ones,
Yeah.
the ones with a random genetic mutation that makes them resistant to the drug, they survive.
And because the weak ones are gone, the strong ones have no competition for resources.
They multiply rapidly, and it's worse than that.
How does it get worse?
Bacteria can actually share genetic material horizontally through tiny loops of DNA called plasmids.
Wait, they share genes?
Yes. A resistant bacterium can physically hand the instruction manual for resistance to a completely different species of bacteria.
That is horrifying.
By prioritizing throughput metrics, by allowing untrained staff to blindly prescribe antibiotics to meet quotas, the system functioned as a deliberate breeding ground for superbugs.
They traded long-term human survival for short-term administrative efficiency.
Look at India right now. The files state that India currently faces a multi-drug-resistant organism prevalence of 83%.
83%.
That means if you go to a hospital in India with a severe infection, there's an 83% chance the bacteria in your body cannot be treated by standard first-line antibiotics.
Just imagine the horror of that.
It's unthinkable.
Going in for a routine surgery or just getting a scrape on your knee in the garden and dying of sepsis because the medicine simply does not work anymore.
This is the reasonable interpretation of the evidence. This isn't just an accident of nature.
It is the delayed consequence of institutional arrogance.
And it isn't just the biology that is collapsing. The human element of the system is breaking the people working inside it.
Yeah, the files detail a phenomenon called the sterile gaze.
The sterile gaze is a tragic symptom of this karmic debt.
Because the nuanced art of clinical history taking has been replaced by liability avoidance protocols.
Modern doctors are trapped. Have you noticed what happens when you go to a clinic today?
Actually, yeah. The doctor barely looks at me.
Right.
They are staring at a computer screen, clicking drop-down menus, furiously typing while I talk.
That is the sterile gaze. Junior doctors are forced to stare at screens, filling out mandated electronic health records designed for billing and legal defense, instead of looking their patients in the eye.
They're trapped in a system they did not create.
Suffering immense psychological burnout. Because the therapeutic bond, the human connection that is the actual foundation of healing, has been severed by bureaucracy.
So we have overburdened hospitals, frightened patients, doctors burning out behind keyboards, and untreatable superbugs threatening to reverse a century of medical progress.
A total collapse.
We connect this back to Dr. Srivatsa's mother, her advice to sit back and wait, and the concept of karma. Is this the universe taking revenge?
Is this cosmic punishment on the NHS for what they did to whistleblowers?
Yeah, is it?
This is a vital philosophical reflection, and it is the crux of the entire narrative. The universe does not need to punish. Karma is not a vengeful entity settling scores on behalf of Dr. Srivatsa. What is happening now is revelation, not revenge.
Revelation, not revenge. Let's unpack the mechanics of that.
The system is simply punishing itself through the mechanical results of its own actions.
Think back to the technical debt analogy.
Exactly. When the software crashes, the computer isn't punishing the coder. It is just executing the flawed logic to its inevitable conclusion.
When institutions replaced clinical wisdom with blind protocols, they chose to protect their image rather than protect patients.
They engineered their own fragility, they built a house out of paper, fired the fire inspectors, and then acted surprised when it burned down.
So the AMR crisis, the burnout, the loss of public trust, it's just the inevitable harvest of the seeds they planted in 2004 when they silenced the truth.
Precisely. The karma has ripened. The universe is simply revealing what was hidden.
The bureaucracy tried to bury the truth of their unsafe practices under legal maneuvers, TUP transfers, and fabricated complaints.
But truth, satya, in Sanskrit, is a fundamental, irreducible property of the universe.
Satya.
As the Taittiriya Upanishad says, Satyam vada dharmam kara. Speak the truth, practice dharma.
When you violate that, the structural integrity of your system degrades.
The crisis we see today is the universe forcibly realigning the system with reality. It is the bill coming due.
After all this, after losing his career, facing bankruptcy, moving his family across the world, and watching the medical system collapse exactly as he predicted, how does Dr. Srivatsa not just become a supervillain?
It's a fair question.
Seriously, why build a lifeboat for the people who sank your ship? Why not just spend the rest of your life writing angry articles?
Because of Swadharma.
Swadharma, what is that?
Swadharma is one's own specific individual duty or purpose. His duty was never to defeat the NHS.
His duty, born from his lineage and his medical oath, was to protect patients.
So he takes all that clinical acumen, the very knowledge that the administration tried to suppress and replace with cheap algorithms, and he digitizes it himself.
He creates Dr. Maya AI and the Prima kiosk.
The creation of Dr. Maya is a profound, constructive response.
It is not an attack on the medical profession.
And crucially, it is not designed to replace doctors. It is an attempt to rescue the profession.
Let's talk about how it actually works, because structurally, it is the exact opposite of the rigid algorithms that cause the misdiagnoses in the walk-in clinics.
Legacy medical algorithms are binary decision trees. If X symptom, then Y diagnosis.
They force a conclusion, which is dangerous when operated by someone without clinical intuition.
Dr. Maya AI does not force a diagnosis. It is based on a 3-symptom, color-coded diagnostic tool built on decades of real-world clinical acumen. It stratifies risk.
So if I'm at home and I'm feeling awful, how does Dr. Maya help me?
When a patient is feeling unwell, their primary emotion is fear.
Yeah, you panic.
They don't know if their child's sore throat is a minor viral issue that needs rest or the beginning of a life-threatening bacterial infection that needs immediate antibiotics.
Historically, driven by panic, they would rush to a clinic, demand an antibiotic, and the overworked staff would prescribe one just to clear the room, fueling the AMR crisis.
Dr. Maya acts as a cognitive buffer.
You interact with the system, input your specific symptoms, and it gives you a color code.
Yes. Green, amber, or red. If it's a minor viral issue, the system gives you a green code.
It empowers you with the knowledge to rest, hydrate, and recover at home.
This prevents you from going to a crowded hospital waiting room where you might catch a secondary infection, and it stops you from demanding unnecessary antibiotics.
But if it's serious,
if the symptom combination indicates danger, a red code, it directs you immediately to a qualified doctor, not an unsupervised nurse, for urgent medical care.
This is what you call cognitive public health.
It restores agency to the patient. It breaks the modern culture of blind dependency and fear.
And critically, it protects the healthcare workers.
By filtering out the minor viral cases, it reduces the flood of unnecessary consultations that cause doctor burnout and breed superbugs in waiting rooms.
If we look at this through the spiritual lens of his lineage, this is breathtaking.
It really is a full circle moment.
His ancestors, the Kadiyali family, were priests and scholars who protected the community's spiritual and physical well-being.
They were the intermediaries of knowledge.
Dr. Srivatsa has essentially taken that ancient priest-healer tradition and digitized it for the post-antibiotic era.
It is the ultimate fulfillment of Loka Samgraha.
He suffered immensely. He lost his worldly possessions. He faced exile and humiliation.
But he never surrendered his dharma.
The institution tried to bury the truth of clinical safety, so he built a system that democratizes that safety, placing it directly into the hands of the public.
He bypassed the corrupted bureaucracy entirely to deliver the healing knowledge directly to humanity.
It is an incredible journey, from the absolute depths of despair and institutional betrayal to creating a tool of global empowerment.
And it really forces us to reflect on our own relationship with the systems we rely on.
For those of you listening, I want you to think about this the next time you walk into a clinic. We are constantly conditioned to implicitly trust the system,
to blindly follow the protocol,
to surrender our intuition to the administrative experts. But when those systems become corrupted by the need for self-preservation, when they prioritize financial metrics over your life, your intuition and your free will become your most vital defense mechanisms.
Healthcare should not be a transaction built on fear, blind compliance, and 5-minute algorithms.
It must be built on empowerment, transparency, and truth.
That is the core enduring lesson of Dr. Srivatsa's story. If there is one philosophical certainty we can draw from both the Vedic traditions and the historical record of human institutions, it is the principle of Satyameva Jayate.
Truth alone triumphs.
A system built on the suppression of truths is a system living on borrowed time. The universe has infinite patience.
You can silence the whistleblower.
You can rewrite the medical protocols.
You can use TUPE regulations to transfer legal liability.
You can bury the evidence under a mountain of HR bureaucracy, but karma is the ultimate auditor.
Truth may be delayed, it may be hidden, and it may bring intense, agonizing suffering to those who have the courage to carry it.
But it cannot be buried forever. Eventually, the bill comes due, not as a punishment, but as a global awakening.
Karma is the ultimate auditor. We started today talking about how we like our medical science to be clean and binary, but how the reality of institutional survival is murky and compromised.
Dr. Srivatsa didn't just point at the muddy waters.
He waded in, found the truth, took the hits, and built a compass so the rest of us could navigate our way out of the false vacuum.
It's an incredible testament to doing the right thing.
It really is. Thank you for joining us on this deep dive.